Our community advisory committees and clinical councils have a really important role in informing our work as a primary health network. They provide really valuable guidance and advice about what's happening in local community and as a PHN, how we can respond to that.
Those two committees, the Community Advisory Committee and the Clinical Councils, are really key roles stated in their name, advising the board and the organisation of some of the issues, or a lot of the issues that occur in our regions. And they provide important, credible and valuable information to our board about issues in the local areas from a clinical perspective and also from a community perspective.
I'd reached a time in my career. I've been a general practitioner in Denny for 35 years. I thought I had a bit of an overview and a bit of an experience of healthcare and healthcare systems, and I wanted to start giving back. An opportunity came to be involved in the primary healthcare network. I started getting involved and had the incredibly refreshing experience of being listened to, getting feedback, and that people were actually acting on the suggestions that we were making.
I got involved as I could see that there was issues in the community that there was no solutions for them, and I was seeing that our health outcomes, particularly in these regional and rural remote areas, weren't as good as our city cousins, and I wanted to escalate that at a local level so that we could probably have some influence on access to primary health care for our communities.
I was asked to get involved when I was still a GP registrar, and at the time I found it was a great opportunity to be able to advocate for registrars in the area and to try and bring some information forward about some of the challenges that are faced by junior doctors.
So I got involved with the Clinical Council because I thought it would be a great opportunity to network with other health professionals, both in dietetics and of course through with other allied health professionals and GPs. And it's given me a really broad aspect into how to improve the health system, and I want to really do that for my local community.
I certainly seek out where there are issues, where there may be gaps in services, and I'm able to be a voice and bring that higher up the chain to the primary health network and feedback, those concerns or those issues that my local community are going through.
I think the reason why I was involved in the board, in the clinical councils, was to allow myself to have a voice within that region and be able to influence policies and procedures of how we can adjust and modify healthcare in the area.
Our PHN covers 124,000 square kilometres, and we know that the communities that we serve are incredibly diverse and vast across such a large geography. It's really important that we remain connected to local communities and we have that feedback from people living and working in their own communities about what might work or what we might need to do differently.
I see it as a role to be able to bring some information to the council about the challenges that are being faced by our community members and things that we see on a day-to-day basis in our clinical work, and to potentially provide some solutions to help address those challenges.
I think that being an advocate is an absolute privilege.
Yeah, it's a good opportunity to have input into the health system, and it's been really interesting actually. I've quite enjoyed it.
So when we help to design or want to implement new health services, it's really important that we know what's going on the ground, and our community advisory councils and our clinical councils really provide us with that grassroots information to guide what we do with funding that's provided.
I found it incredibly rewarding to work with a PHN, that I could say something, they would listen, they would take it back, they would implement something, and they'd come back with a strategy and say, what do you think about this? And I'd go, oh my God, that's fantastic.
So what I would say to my colleagues working in primary healthcare is, if you have ever thought that you would like to have a seat at the table, if you've got some great ideas about how we could potentially improve how we deliver our services to the community, if you've got some issues that you think need to be brought to the PHN's notice and things that you think need to be improved on, then consider joining the council, because you'll always be able to have your say, and yet we can work together to provide solutions.
Health professionals need to advocate for their communities because we have a listening ear. MPHN are keen to hear from us. There's such great work being done in the health area, but there's so much more that needs to be done, and MPHN are wanting to hear our input from our little country towns.
We encourage everyone to bring their local voice to our advisory groups and our councils so that they can inform the solutions that we develop to address the needs at a local level.